Okay.
All right, we're recording. Hello again, everybody. It's Dr. Tim Newton with Inspire Movement Physical Therapy. We are back at it again in our interview series with local health and wellness practitioners. We have a very special guest, probably the most enthusiastic healthcare practitioner I have ever met. She is a phenom, and I'm excited to share her knowledge and expertise with you today. Her name is Sara Keough. She is an eco-nutritionist. She owns a practice called Econutrition, which we'll talk a little bit about here. One of the most qualified nutritionists I think you're ever going to come across. She got her BS in biology, then recently after that, her master's degree in nutrition and integrative health from MUIH, the Maryland University of Integrative Health. And after that, she got certified as a nutrition specialist with the nationally respected American Nutrition Association. Whew, I'm having trouble keeping up with all this. She's at national conferences. And not only does she just do nutrition for general health and wellness, but she also helps conditions related to things like hormonal imbalances, digestive problems, detoxification issues, inflammation, immune system disorders, cardiovascular disease, and blood sugar imbalances, among other things. She is specially trained in spectracell micronutrient testing, which is very, very important for the functional and integrative practitioners out there. And she's just very passionate about getting to the root cause of illness and disease. So without further ado, Sara, thank you so much for joining us today.
Thank you for having me. That was such a cool intro.
That might have been my longest one yet.
Oh, thank you. Very, very kind intro. And so just to kind of explain what I do, I know we kind of chatted about this. A lot of people don't quite know what an integrative nutritionist does.
Yeah,
And
tell us about that.
yeah, I can kind of explain a little more what happens maybe in the first session, and it's so much more than just meal planning and telling you what to eat. But I give patients first a really comprehensive intake form. You know, we're going to go over health history. You can send me lab work, and in that first session, I'm getting to know you and what your goals are. And I always tell patients I'm focusing on 5 foundational areas, and that's nutrition, of course, my specialty, but we're going to talk about sleep and circadian rhythm, because most humans, we're so out of tune with, the earth's rhythms, and that has so much impact on our sleep, our hormones, our gut. Sleep, circadian rhythm, stress management, and even like digging deep to address traumas, because traumas are a really hidden cause of a lot of conditions for people. Physical activity, getting the right type of movement for you. And that's where this guy comes in and is amazing to help your body move the way it's supposed to. And 5 is hydration, and not just quantity, but quality of water. Because, I have so many patients that are drinking tap water through a Brita filter, and I'm telling you, that's not going to filter out all the things in your water. So, those are the 5 foundational things. So nutrition, sleep, stress management, physical activity, and water. And then to help me really dig deep to figure out what you need as an individual, because at the end of the day, I'm coming up with a personalized wellness plan for you. And so that entails some testing. So some what we call functional medicine testing. And that's a micronutrient test. I also look at omega-3s and 6s, and also looking at food sensitivity testing. So I kind of consider those the 3 foundational tests. There's things I do beyond that, maybe looking at cortisol testing, which is tied into circadian rhythm, hormone testing, stool testing to see what's happening within the gut. So
you can test all that stuff.
Yeah, absolutely. Yep.
That's
I can run
cool.
testing for all of that for clients. So yeah.
What is like the timeline? So I come and see you on day 1.
Uh-huh.
Do I just kind of like let it all out there? Here you go, Sara. Here's everything. Here's some stuff. And
Yep.
I'll see you in a week. Like, how long does this take?
That's it. Like, lay it on me, tell me
right.
everything that's going on, because I want to know everything. And I ask a lot of questions about the details. And I find that a lot of people definitely need intensive gut healing. even if they don't think they do. There's so many gut issues out there. So that's one thing I really focus on a lot. But that first session is 90 minutes, and we're going over your intake form. We're going to lay down some foundational goals to get started on nutrition wise, and the next steps for getting the testing done. And I usually tell patients meeting every couple weeks is ideal in the beginning. So we're going to meet every couple weeks for a follow-up, for an hour follow-up, and talk about next steps. I might have you do some food tracking so we can look at the carbs, the proteins, and the fats. But one thing I've learned from one of my mentors, Dr. Ron Grabowski, he's an amazing doctor down in Houston. He says we're made up of 6 things, and that is water, and then the macronutrients, which is the fats, the carbs, the proteins I mentioned. So everyone knows how to kind of count those and weigh and measure those. But the vitamins and minerals are extremely important to address too. Those are the other 2 categories. So, you know, we kind of get things dialed in with the macronutrients, and then we start talking about next steps for testing with the micronutrient test. So usually I tell
Those are the
patients
vitamins and minerals. Those are
vitamins and minerals. Yeah, yep, the
got it.
micronutrient
Okay.
test. So I tell patients within the first 3 months, we're probably going to do those foundational tests with the micronutrients, the omega-3s and 6s, and the food sensitivity testing to see what foods are provoking any immune system reactions or inflammation in the body, because you're not always going to have an obvious symptom of that.
Right.
For example, over half my patients are coming up with some kind of egg sensitivity, and they don't know it. And then we
Right.
eliminate it, and all of a sudden they're seeing symptoms clear up. So,
How
yeah.
long does it normally take to see change in this process? Do you feel like some people have it immediately, or does it usually take a couple of months? Like, what do you tell somebody on day 1 when they come in?
That is a really great question. And it depends on what it is exactly. And also it depends on the commitment level of that patient and how compliant they are. So patients that are
Yeah.
just really good, right? You know, clients have to have accountability too, and follow through on things, because when they do, those are the patients I see get amazing outcomes almost right away. Some people start feeling better within a few days to a few weeks. And it depends on the symptoms. It depends on exactly what it is. It depends on how chronic it is. You know, if it's been a lifelong condition, sometimes it takes a little while to see that shift. It might take a few months. When it comes to gut healing, for example, just a few simple changes will produce amazing outcomes, like literally life-changing outcomes, is what people have told me within just a few days. So it
Yeah.
just depends on what symptoms specifically we're talking about and how chronic it is.
Hey, and you and I both know, we can think of a mutual client that we had who had a hip that would not cooperate, and you got it cooperating a lot better. And I have to chalk it up to your expertise in getting that inflammation down and
Thank you. Yeah. And he's
letting.
amazing. He's one of those superhuman I tell him you're superhuman. He totally is amazingly compliant, and he got spectacular outcome. So
Well, yeah, hey, and you know what? That's a great example of your expertise only goes so far. It has to be met with somebody who is going to go through with it too. So
yeah,
a lot of it is, you know, the door is open, but are you ready to walk through?
exactly. Yeah. And if patients need something that's slower paced, that's where communication is important and the follow-ups are important, right? Because
Yeah,
if it's too many goals and too many things to do and you can't keep up, we can slow it down a little. And if
right.
you're like, hey, I want more, keep giving me some more things to work on, we'll speed it up, you know? So I always want to meet the patient where they're at, and I don't want people to feel like, oh, I can't do everything, you know, I'm too overwhelmed. It's always making it work for everyone's lifestyle. And at the end of the day, what I want people to understand is it's super personalized. Everything I do is really personalized and individualized to you. So no cookie cutter protocols. It's what's going to work for you.
That is awesome. So what can you tell us more? Like, what makes your practice different than like just a regular nutritionist that I feel like I hear a lot of people say I'm a nutritionist. So just like to, I guess, educate our audience a little bit about what's a little bit different in the way that you run the practice and your priorities.
Yeah, I mean that's a really good question too, because you know, like I mentioned previously, I think a lot of people don't have a clear idea on what nutritionists do, and that's understandable. You know, most people have never worked with a nutritionist before, and there's different types of certifications and degrees. There are like health coaches and maybe like a certified nutritionist that doesn't have some of the advanced clinical skills, and they might focus more on maybe meal planning. You know, focusing like really food focused, which is important. It's definitely part of what I do in my practice. But I've taken that a few steps further to really dive into the clinical work and get the extra training on that, because it's so instrumental in helping me individualize my plans for people. And so I'm always telling patients, like, I want to teach you how to fish. I don't want to just give you the fish, right? You know that
Right.
old saying. So it's like, I want you to be able to nourish yourself for your lifetime and not have to be dependent on meal plans. So I'm not here to just hand you out a meal plan and say, here you go, here's what you eat, here's your shopping list, here's, you know, the recipes. That might be helpful in the beginning, but ultimately I'm trying to teach people how to learn how to intuitively construct their meals and you know, follow certain dietary guidelines with, you know, to put it into habit, become a lifestyle change and not just like a diet that you have to follow. So I think digging deeper and getting to the root cause with the clinical work I do with the testing is also part of what, you know, makes my work a little different.
And I think that's absolutely right. For those of you, well, no one I guess knows I'm watching this. We were in a meeting of, we'll just say, integrative and other healthcare professionals, and I was sitting there watching Sara educate integrative physicians on their micronutrient testing results. I was just blown away. You know, I'm just a PT. You want to talk about tendons? I'm here for you. You want to talk all day. But that
Right.
stuff, I was just like, whew, just sweating, trying to keep up with it. It was crazy. But it was very, very impressive. So how did you, what's your story? How did you get into the profession in the first place?
Yeah, good question. So, well, the name, you know, I should explain a little bit about the name of my practice, Econutrition. So, you know, I'm from Colorado. I moved out here it's Maryland about 7 years ago now. Actually 8 years ago. Back in Colorado, my focus was in ecological work. So I was actually going on to become a conservation biologist. So I was very passionate about, you know, the environment and restoring ecosystem health. And I've always been studying nutrition though, like since I was a kid. I was picking up like the you know, the home herbal remedies, Doctor's Book of Home Remedies, or the Encyclopedia of Healing Foods. I was seriously sitting there reading those as a kid. So I always had an interest in health and nutrition. And probably within the last year of my undergrad program, my biology program, I felt like I was at a crossroads. I was really passionate about health and nutrition. I really loved conservation work and being outside and not having to be, you know, in an office all day. But, you know, I decided to go that path of clinical work and get involved in nutrition. And that's when I research schools all over the country. I loved the program that MUIH offered, and so I actually took a huge leap of faith. I moved out here, didn't know anybody. It was it was a rocky road at first, you know, making that huge
Yeah.
transition. But yeah, and I am so happy I made that decision because I absolutely love what I do. I actually thought I was going to get into research, Tim. I didn't even think I was going to do clinical work. I was like, I don't know if I want to work with people. I think I just want to keep doing research because I was very much on a research track. And
Yeah.
then I did a clinical internship, right, in my undergrad or my master's degree program in grad school, and I loved it. I loved working with people. You know, I'm a people person, and seeing. I just think the most rewarding part of my job, as you probably experience this too, is when people tell you how much you've changed their life. And it's always touching to me. It always touches my heart to know that I've helped someone live their life more fully, help them get their vitality back. And because I also know what it's like to be sick. So, you know, a little bit about my journey, and that I was very sick. I suffered for over 20 years with an eating disorder, and I struggled with binge eating. I've been super overweight. I've been super underweight. I had a lot of issues around food, and I see that a lot with people too. There's a lot of disordered eating patterns out there. Sorry for the helicopter going over.
Oh.
I don't know if you hear it.
Yeah, you're
So,
good.
you know, I know people struggle with a lot of with their relationship with food, and so that's also a lot of what I address in my practice too. And so yeah, I was sick and unhealthy, and nutrition changed my life, and learning what I learned in my program changed my life. And I knew I had to just share this with other people.
That's awesome. So can you tell us about the eco part? The eco
Yeah. Oh gosh,
in you?
absolutely. Yes, one of my favorite topics.
I've
So
heard
the
I've heard
other,
the very long version of this, and it's awesome. But
yeah,
I
you've
guess
seen
the
the
Cliff's
webinar,
notes.
right?
Yeah, yeah. Go
Yeah.
ahead.
So, in a nutshell, so it's, about several years into my clinical work, I really started investigating, what is going on with our food system. Why is it that patients or clients, that aren't from the United States, tell me our food has no flavor? I'm sure many of you have experienced, going out of the country and you're like, wow, this food has so much flavor, it tastes amazing. And I realized there's something really wrong with our food. It's lacking in nutrition, and we keep hearing that, right? Like the fruits and vegetables we have today are lacking in the vitamins and minerals that they had, a couple generations ago. And it all goes back to soil. And unfortunately, our soil has been badly eroded, especially in this country, through industrial agriculture, the use of these harsh agrochemicals, Roundup and other pesticides, things like that, fertilizers. The FAO, Food and Agriculture Organization of the UN, gave a very alarming statistic, and that we have less than 60 harvests left throughout the world, really, before we have no topsoil left. That's less than 60 years before we
That is
can produce
insane.
food. It's scary, right? So what I started learning about was something called regenerative agriculture. And just like the name implies, it's about regenerating soil. And regenerating soil involves many different things. Again, I can go on for hours about that topic alone, but essentially it's how farmers farm with nature and not against it with the uses of these agrochemicals. Having animals properly grazed on the land is absolutely critical for restoring ecosystem health. So herbivores are important for that. Cows, lambs, goats, all that help restore ecosystem health, but also farmers that are also doing other things that nourish the soil. And again, I can get into the technical farming stuff, but but yeah, so that's essentially my practice is about also teaching people how their food choices are impacting the environment and helping to regenerate soil. So I'm super passionate about people supporting local farmers. And so I work with a few farming organizations to promote their work. And I'm all about connecting people to, who's that local farmer that could be possibly in your neighborhood that's actually working on restoring soil health versus just getting the organic produce from the supermarket, So I'm always tying that into what I do. And that's been the other most rewarding aspect of my career is connecting with the agricultural community and supporting them.
That's amazing. The whole spectrum, from getting somebody to live their fullest life to soil.
Yeah.
It all starts with dirt.
It all starts with dirt. We come from the dirt.
That's right. I love it. All right. Last question for you here. My favorite question. What words of wisdom would you give to someone else in your profession who's looking to make and have a more successful and impactful career?
I would say remain curious and open to where your journey takes you. So if you're interested in getting into, a career like this where you want to work with people and help them with their health, you have many, many options, okay? But, just depends on how clinical you want to be. If you just want to work on more of the food aspect of things, if you want to learn about some of the advanced testing, I highly recommend going on to get a graduate degree and a board certification, and then you can get licensed within your state to practice nutrition and order testing and things like that. But remain curious and remain open to where your journey will take you, because like I said, I never thought I was going to be doing clinical work. I was determined to just do research, and I'm so glad I didn't, and I'm glad I opened my mind to some other possibilities. But the sky's the limit. You can write, you can blog, you can do clinical work, but always remain curious and ask questions. You will never get bored in this field. That's also my other thing. If you get into nutrition, me and my mentor, I mentioned Dr. Ron Grabowski, he's like, people asking me for advice, I just tell them, you're never going to get bored in this field. There's so much to learn. It's constantly evolving. So don't let yourself get overwhelmed with that. Just remain curious and open, and you have to love learning because you're always good. You're going to constantly be learning in this field.
That's amazing. Sara, thank you so much. I really appreciate you coming on today and sharing just a teeny bit of all of your knowledge. What is the best way for people to contact you or get in touch with you?
Yeah, so you can email me. It's sarah.econutrition@gmail.com. So that would be the best way to get in touch with me. So send me an email and I can give you more information about how we can get started with, getting you on your path to wellness and your journey.
Fantastic. Well, thank you so much for joining us. And is there anything else you want to say to our folks out there?
Support your local farmers. They're truly, I feel like, often patients will say, thank you for helping me to heal, and you're a healer. I'm not really a healer. I'm helping to facilitate your healing process. Our farmers out there working to restore the soil and produce nourishment for us, they're the healers.
Yeah.
So farmers are the healers as well. So please support your local farmers as much as you can.
That's great. All right, you heard it here, folks. All right. Thank you so much again. And thank you to all of our people watching this, and have an inspired day. We'll see you next time.
Thanks, Tim. Bye, everyone.